A very good morning to all the students. So today's class we will be discussing about the functions of the skin and body temperature regulation. So by completing this topic we will be ending up the excretory system. So the anatomy of the skin has already been discussed in the anatomy classes in detail along with the histology of the skin also. So we will be dealing with the functional aspects. Coming to the functions of the skin, the first and very foremost function of the skin is protection. So skin, it forms the covering of all the organs of the body and it protects these organs from the following factors. So one is protection from the bacteria and toxic substances, then protection from the mechanical blows, and third one, protection from the ultraviolet radiations. So the skin protects from the following three things. Now coming to the first thing, that is protection from the bacteria and toxic substances. So how this happens? So what happens is from the skin lysosomes are being secreted, and these lysosomes, they destroy the bacteria which come in contact with the skin, and along with that the keratinized stratum corneum of the epidermis layer of the skin. So this is responsible for the protective function of the skin, and it also offers resistance against the toxic substances like the acids and the alkalis. Now when this protective layer, that is the skin layer, if it is damaged, so at that time what happens, the organisms which are present on the surface of the skin, they invade and they cause the infection. Now what will happen when there is injury or infection to the skin? So at that time what happens is the keratinocytes, they will start secreting two things. Okay, one is the cytokines and second is the antimicrobial peptides. Cytokines like the interleukins, then tumor necrosis factors, then gamma interferons. So these, what they do is they play role in inflammation, the immunological reactions, tissue repair and wound healing. So whenever the skin is damaged, so what happens is the keratinocytes which are present in the layer, skin layer, the epidermis layer, so they secrete these things. One is the cytokines and the second one is the antimicrobial peptides. So like the beta defensins, and these, what they do is they will try to prevent the invasion of the microorganisms. Now I just now told you that the skin also protects it gives protection from the mechanical blows. So how it happens? So the skin, it is not tightly placed over the underlying organs, so it is loosely placed, somewhat loose, okay, and it moves over the underlying subcutaneous tissue. So as a result, what happens is whenever there is any mechanical blow or any mechanical impact of any blow to the skin, so that will not be transmitted immediately to the underlying tissue. Some amount of the blow is taken by the skin, so it prevents the complete impact from getting going and affecting the internal organs. Coming to the third thing, how the skin provides protection is it provides protection from the ultraviolet radiations or ultraviolet rays which are present in the sunlight, right? So whenever we are exposed to the sunlight, so what happens is, so definitely in the sunlight we have ultraviolet rays, and once these ultraviolet rays, they fall on our skin, so there is production of the melanin pigment from the melanocytes in the skin, and this melanin, it is having a protective function. It protects us from the ultraviolet rays by absorbing them. So for that reason you can say that ultraviolet radiations, as you all know, so it is one of the factors which can cause skin cancer. So more exposure to UV rays can cause skin cancers. So we Indians, as we are having sufficient amount of melanin, okay, Indians are either dark brown in color or brown in color because of the presence of melanin. When you compare it with the Europeans or Americans, so they have got less amount of melanin, so they are more prone to the skin cancers because of less production of melanin whenever they are exposed to the ultraviolet radiations. So not only this melanin produced in the skin. So at the same time, even what happens is when the skin is exposed to the ultraviolet radiations, the thickness of the stratum corneum also increases, and this layer, it also absorbs the ultraviolet rays. So melanin also is absorbing, and the stratum corneum, the thickened stratum corneum layer, this is also absorbing the ultraviolet rays, and hence it is providing the protection. So protection is being provided by the skin. So what it does is it protects us from the bacteria and other organisms. Then it is providing the protection from the mechanical blows, and it is providing the protection from the ultraviolet radiations. So this is the foremost and a very main important function of the skin. Moving ahead to the next function, sensory function. So the almost whole of the body is covered with the skin, right? So and the skin is considered as the largest sense organ in the body, and it has got rich nerve supply, right? So there are many free nerve endings, and these form the specialized cutaneous receptors, and these receptors, they are stimulated by various sensations, right? The touch sensation, fine touch, crude touch, then you have got pain, then hot temperature, cold temperature, pressure, vibration, all these sensations, okay, so they are going to stimulate the cutaneous receptors which are present on the skin, and these sensations, they are conveyed to the brain by the various afferent nerves, and finally what happens is at the brain level, the perception of the various sensations is going to occur. So this is the second function of the skin. Coming to the third function, storage function, right? So skin, it stores some amount of fat, or you can say considerable amount of fat, then water, and chlorides and sugar also, right? So whenever a person starves, right? So what happens is the person who is like initially when he was healthy, he was somewhat moderately built, good enough, right? So once he undergoes the starvation, so what happens is you can see that he becomes thin, and at the same time even the skin, it becomes thin, and so whatever fat is present below the skin, so that is going to be utilized, and at the same time what happens is even when the person undergoes experiences severe dehydration, so again you can see the dry skin, right? So that gives an indication that there is storage of fat, water, and even chloride and sugar is also present, right? At the same time, even the skin is also storing the blood. How it does that? It does by the the dilatation of the cutaneous blood vessels, right? So this is about the storage function. Coming to the next thing, that is synthetic function. So it synthesizes. So we all say to like our relatives or patients, like, please get exposed to the sun, please get exposed to the sun, especially in the early morning, about 6 o'clock to 8 o'clock, please get exposed to the sun. The reason here is because the skin will synthesize the vitamin D3, right? So this vitamin D3, again, you know, it is very, very essential for the absorption of the calcium, right? And it helps in the homeostasis of the calcium in the body, right? And this vitamin D3, it is synthesized in the skin by the action of the UV rays present in the sunlight on the cholesterol present in your body. So hence, skin also has got a function, that is the synthetic function. It helps in the synthesis of vitamin D3. So naturally available vitamin D3 can be synthesized. Not necessary that you should pop up the vitamin D3 tablets or granules. Okay, God has given so much abundant amount of source of vitamin D3, and that is sunlight. So that we need to utilize. So encourage all the people to get exposed to the sunlight at least about 15 to 20 minutes in the morning. Right. Next, coming to the next function, that is regulation of body temperature. Right. So skin, definitely it plays a very important role in the regulation of body temperature. So whenever there is excess heat in the body, right? So that heat is lost from the body by 4 mechanisms: conduction, convection, radiation, and evaporation. So by these methods, the heat is lost from the body, and it helps in the maintenance of the body temperature. Right. Next, it also helps in the loss of the heat from the body by the production of sweat, right? So we got sweat glands in the skin. So these sweat glands, they produce sweat, and through the sweat the heat is lost in the body, and also it helps in the maintenance of water balance also by excretion of sweat, water and electrolyte balance also, right. Now along with the sweat glands, there are also sebaceous glands, and these sebaceous glands, they produce a sebum, and this sebum, it has got lipid content also in that, and this lipid content of the sebum, what it does is it prevents the loss of heat from the body in the cold environment by making a layer on the skin, right. So this is about the regulation of the body temperature by the skin. Next, regulation of water and electrolyte balance. Just now I was telling you. So about the production of the sweat. So when the sweat is produced, so it contains definitely water and electrolytes. So hence the skin is regulating this water balance and electrolyte balance by excreting the water and also the salts through the sweat. Next, coming to the excretory function. So skin, it excretes some amount of waste products like urea, salts and fatty acids. It is not in a very significant amount, but it cannot be even neglected also. Some amount is definitely it is being excreted from the skin. Okay. Now coming to the next function. So whenever we get any soft tissue injuries like blunt injuries we get, and we have any myalgia, so what we tend to do, not only we tend to take oral medications, so at the same time what we do is we apply ointments, or we apply gels, or we apply even sprays, hot fomentation. So applies this one. Please remove the hot fomentation thing. Gels, then ointments and sprays. Right. So how they are going to help you out? The reason is, so they are fat soluble. So as a result, what happens is the skin will absorb these fat soluble substances, and as a result, what will happen is it gives us relief. Okay. So this is about the absorptive function of the skin. Coming to the secretory function. So again some repetition here. So you have got sweat glands and sebum glands in the skin. So sweat glands are going to produce the sweat and helps in body temperature and water balance. And sebum, it helps to keep the skin moist and smooth, and also the lipid content of the sebum. Okay, so it is helping in retaining the temperature inside the body, preventing the loss of the heat during the cold climates. So these are all the functions of the skin, and this can come as a short note for you people, or it can be asked as a 3 marks question. Okay, if it is asked as a short note, so you need to mention all the functions, and you have to give the description about each function in detail. And if it is asked for a 3 marks question, so at least you need to write the names of all these functions, and discuss at least about 5 to 6 points in detail. So that will fetch you good amount of marks. Now moving ahead to the next part of today's class, that is body temperature regulation. So before going to the body temperature regulation, let's discuss something about the body temperature, the normal body temperature, and by what routes the body temperature is recorded, and then what is the core body temperature. So we will first discuss about that, and what are the different mechanisms by which the heat is generated in the body, and by what mechanisms the heat is lost from the body. Because if we discuss these things, discussing the temperature regulation will be very easy, right? So first we will discuss about the various aspects related to the body temperature. Now coming to the body temperature, right? So where all it can be measured? Okay, so it can be measured by placing the thermometer in the mouth, so that will give you the oral temperature. In the axilla, it will give you axillary temperature. Rectum, it gives you the rectal temperature, and over the skin, that is the surface temperature. Now mouth, the oral recording the oral temperature, like it has been gradually weaned out because of the infection part, the spreading of the infection part, right? And now, as you all know, the COVID situation is going on, right? So even the recording the axillary temperature is not being encouraged. So we are going to check the surface temperature by using the infrared thermometers. So you can see that everywhere, wherever you go, without checking the surface temperature with the help of infrared thermometer, they are not letting you go inside. Even in small shops, even in small malls, anywhere and everywhere you can see, right? And that is good. That is good to prevent the spread of the COVID infection, right? Now coming to the normal body temperature, right? This is something which we all have read in the school days itself, right? So either it is in centigrades, it is 37 degrees centigrade. and in Fahrenheit it is 98.6 or 98.4 Fahrenheit, and this is measured by placing the clinical thermometer in the mouth. So this is the oral temperature, right? So 37 degrees or 98.6 degree Fahrenheit. This is the oral temperature, and if you take the range, it varies between 35.8 degrees centigrade and 37.3 degrees centigrade. So this is a normal range, but on an average, so we consider 37 degrees centigrade is normal temperature, oral temperature. Now if you check the temperature in axilla, so it will be about 0.5 to 1 degree Fahrenheit less than the oral temperature. And if you take check the rectal temperature, it will be 0.5 to 1 degree Fahrenheit higher as compared to that of the oral temperature. Almost like if you check the rectal temperature, it is nearer to the core body temperature, you can see, right? Next, coming to the superficial temperature, that is skin temperature. So here it varies between 85.1 degree Fahrenheit to 93 degree Fahrenheit, right? So this is the range for the superficial temperature, and I was telling you about the core body temperature, right? So what is this core body temperature? So core body temperature, it is the average temperature of the structures present in the deeper part of the body. Earlier what they used to do is they used to introduce a catheter into the heart and check the temperature. So that is a very, like, it was in experimental stages, that cannot be done now, right? So that is how the core body temperature was being checked, right? So it is always more than the oral or the rectal temperature. It is about 37.8 degrees centigrade or 100 degree Fahrenheit. I am talking about core body temperature, right? But here what we do is, whenever we check, we consider the oral temperature, what we are relating with the oral temperature, right? 37 axilla 0.5 to 1 degree Fahrenheit minus the oral temperature, and if you check the rectal temperature, it will be 0.5 to 1 degree Fahrenheit more than the oral temperature, right? Core body temperature, it is nothing but the average temperature of the structures present in the deeper parts of the body, right? So core of the body, right? Now coming to the next aspect, that is heat balance, right? Now gradually we are going towards the aspect of temperature, body temperature regulation. So for that we need to know about the heat balance, right? So the regulation of the body temperature, it is depending upon balance between two things. One is heat gain or heat production in the body, and second is heat loss from the body. It is simple. Whenever the body temperature is more than the normal, the body tends to bring back it to normal by losing the heat from the body. And whenever the body temperature is less than the normal, the body tends to produce the heat so that it comes back to the normal. So those are the two things which we need to discuss, right? Now coming to the first one, that is heat gain or heat production in the body, right? So there are various mechanisms which are involved in this process. So what are those mechanisms? Coming to the first one, that is the metabolic activities, right? Metabolism, right? Basal metabolic rate. So all these words are correlated here, right? Now the major portion of the heat which is produced in the body, it is coming from the metabolism, right? The metabolism of the food which we are eating, metabolism of the foodstuffs which we are eating, and this is called as the heat of metabolism, right? And here again aspects are metabolism produced because of heat produced because of metabolism of proteins, carbohydrates and fats. So this is a general knowledge thing. You might have this one read in various general knowledge books, that the heat generated during metabolism of fat is the highest, followed by the carbohydrates and followed by the proteins, right? So let's see how much heat is being generated. So when 1 liter of oxygen is utilized, okay, when 1 liter of oxygen is utilized and this one fat is metabolized, 9 calories of heat is produced during the metabolism of fats. Similarly, coming to the carbohydrates, 4.7 calories of heat is being generated, and when the protein metabolism occurs, about 4.5 calories per liter of oxygen is being produced. So by this you can make out that the heat of metabolism is highest for the fat, followed by the carbohydrates and followed by the proteins, right? And the organ, if you take, liver is the organ related to the metabolism, as we all know. So that is the reason why the maximum heat is being produced in the liver, because of the metabolic activities. So this is about the metabolism, heat of metabolism. Next is the muscular activity, right? So we all know that even at rest, there is a partial state of contraction of muscles, and that is called as muscle tone, right? So even at rest also some amount of heat will be generated, because there is some partial like contraction of muscle is there at rest also, right? So along with that, whenever we do any muscular activity, automatically the heat is also going to be generated. Now this heat which is generated during muscular activity, it is called as the heat of activity. And you all know body has got some smooth muscles and it has got some skeletal muscles also. So 80% of the heat, it is generated by the skeletal muscles, by the action of the skeletal muscles. Now coming to the role of hormones. When we were discussing about thyroid hormones in the endocrine physiology, right? In the applied aspects, we discussed two things. One is hypothyroidism and second one is hyperthyroidism. So hypothyroidism, we had discussed that the person will have cold, the body will be very cold, right? And the basal metabolism rate will be less. Whereas in case of hyperthyroidism, the person will have, the body will always be heat. So cold intolerance will be there, right? So there will be always, the body will be always heat, and also their basal metabolic rate is on the higher side. Now why that is happening? That is happening because of the thyroid hormone. So thyroid hormone plays very important role in the basal metabolic rate. So for that reason, thyroxine, it is going to increase the heat production. So for that reason, we are including the thyroxine in the role of hormones for the generation of heat. And at the same time, even the catecholamines, that is adrenaline and noradrenaline, so that also is involved in the production of the heat by increasing metabolic activities. Next, the next factor is radiation of heat from the environment, right? So the body is also gaining the heat by radiations, right? So we whenever there is cold, right? So what we do, we are going to light make a campfire. Very commonly you can see nighttime campfires, going and sitting in front of that, and we are keeping our hands in front of that. Why? Because we are trying to get that radiated heat, right? So this is one more way how the body gets the heat, right? Next is shivering. Yes, very important thing. Whenever we are exposed to very cold temperature and we want to warm ourselves, not that we purposefully shiver, it is the body's response to the this one reduced temperature. So at that time, what will happen? There will be rapid and involuntary contraction of the muscles. I repeat once again, this is not voluntary, okay? This is involuntary. It is not that we are purposefully shivering. It is automatically the shivering is happening, right? So here that helps in the production of the heat during exposure to the cold, and it is nothing but a physiological mechanism, right? Next factor or the next method, the next way which is responsible for the heat production is the brown fat tissue. So this is more in small children, right? The neonates and the infants, you can say. So this plays a very important role. That's the reason why they are always warm. Okay, that keeps them warm, right? Because of the brown fat tissue. So this there is one more fat, that is white adipose tissue, which is adequate in we all right now, right? Okay. This brown fat, so what it does is it produces enormous body heat, and it is helping in the keeping the body warm in case of the infants and the neonates, right? So this is about the heat production. Next, how the heat loss is occurring from the body, right? So here the maximum heat of the body, it is lost through, majorly it is skin itself. Majorly it has to be skin by conduction, convection, radiation, evaporation, and in dogs there is one more thing, panting, that we will be discussing right now. Okay. And apart from this, small amount of heat is also lost by other systems. So what are the other systems? Respiratory system is there, then you have got the excretory system, okay, and then the GI tract is there, right? Respiratory system, you blow the air on your palm, so you can feel the warmth because the heat is lost along with the expired air, right? In the kidneys again, okay, when the person passes the urine, the urine is not like a cold stream of water, okay, it is warm, right? When the person is passing the urine, it is warm because some amount of heat is also being excreted, and even it applies to the GI tract also, wherein the feces, it is again, it will be warm, right? So these this one what heat loss, right? So when it happens is whenever the environment temperature is more it is more than the it's less than the body temperature, right? So in such conditions the heat will be lost from the body, right? How the things are happening here? First is conduction. 3% of the heat is lost from the surface of the body to other objects. So whenever you sit on a chair or you sleep on a bed, after getting up, just keep your hand on it and you see it will be warm, because some amount of heat from your body has been lost to the surface where you had sat or where you had slept. So this is conduction. Next is radiation. So 60% of the heat it is lost by means of this radiation. It is nothing but the transfer of the heat by infrared electromagnetic radiations from the body to other objects through the surrounding air, right? Next is convection. So here it is about 15%. So 15% is lost from the body to the air by the convection. So first the heat is conducted to the surrounding the air which is surrounding the body, and then it is carried away by the air currents. So this is called as convection. And next is evaporation. So what happens is every hour, even if you sit quietly also, some amount of water is being continuously lost from the body in the form of sweat, right? And this is about 50 ml per hour, and it is called as insensible perspiration. It is called as insensible perspiration. So if you take the evaporation process, so heat is lost by this, and 20% of the body's heat is lost by this process of evaporation, right? So just now I told you about the insensible loss, that is insensible water loss, insensible perspiration. It is about 50 ml per hour. Whenever the body temperature increases, so sweat secretion is increased, and the water evaporation, it is more with the more of heat loss. So this is about the evaporation. Next is panting. This is not more in the animals, dogs, especially the dogs. So there what happens is they have got very less amount of sweat glands, right? So to lose the heat from the body, especially in the summer season, so what the dogs will do is they are going to rapidly they are breathing, the shallow breathing will be there, and along with that the tongue is outside, and you can see that the saliva will be dribbling from the tongue. So that is the panting, and it is nothing but it is to lose the heat from the body. It is to lose the heat from the body because they don't have adequate sweat glands in the body. So this is one more way, not in human beings, it is more of animals. Now coming to the regulation of body temperature. Okay, so the body temperature here, it is regulated by hypothalamus. So when we were discussing about the hypothalamus, so one of the major functions of the hypothalamus, even we have discussed about the body temperature regulation and how this is going to happen, right? So the temperature is regulated by hypothalamus, which sets the normal range of body temperature, and the set point under normal physiological condition is about 37 degrees centigrade. And hypothalamus, how it regulates is, it regulates with the help of two centers. One is heat loss center and second one is heat gain center. Coming to the heat loss center, it is present in the anterior hypothalamus. Okay, so it is present in the preoptic nucleus of the anterior hypothalamus. So here you have got heat sensitive nerve cells which are called as thermoreceptors. So whenever these thermoreceptors are stimulated, whenever the warm blood or the blood which is having more temperature, it is passing through this part of the hypothalamus, what happens is the thermoreceptors are stimulated, and these thermoreceptors, they finally what they do is they will bring about the cutaneous vasodilatation and sweating. So as a result the heat is lost from the body, and hence the body temperature is regulated. Now if this heat loss center is removed, or if there is any damage occurring to this heat loss center, automatically what will happen is the body temperature will automatically go on increasing, because the thermoreceptors are not giving it the proper message. So automatically, even if the body temperature is more, so it is not going to sense it, and automatically what will happen is the heat loss center is not going to function. So hence what will happen, the body temperature will continuously, it will be on the higher side itself. right? This is about if the heat loss center is damaged, right? If the preoptic nucleus of the anterior hypothalamus, this portion, if it is damaged, so what will happen is the body temperature will be continuously on the higher side, right? Similarly, heat gain center, it is present in posterior hypothalamus, right? So it is present in the posterior hypothalamic nucleus, and the heat gain center is also called as heat production center. And if this heat gain center is stimulated, there will be a protective mechanism to produce the heat in the body, that is shivering. That is nothing but shivering. And ulta will happen if the heat gain center is removed or there is damage to this. So what will happen? There will be fall in the body temperature, right? Even if the body temperature is less, it will be kept maintained less itself. It will not be increased because it is not sensed, right? Okay, so this is about the heat gain center. Now coming to the mechanisms of temperature regulation, right? So what happens when the body temperature increases, right? So when the body temperature increases, automatically the the temperature of the blood also increases, and once this blood temperature is more, when it is passing through the hypothalamus, when it is passing through the preoptic nucleus of the hypothalamus, the thermoreceptors are stimulated, and as a result what will happen is immediately the preoptic nucleus, okay, it will be stimulated, and hence it will see to it that the heat is lost from the body, right? Heat is lost from the body, and at the same time here heat production is also reduced, because you want to bring back the temperature from higher temperature to the normal temperature. So here two things need to be done. One is heat has to be, the excess temperature has to be removed from the body, and second thing is the production of the heat also has to be reduced. So then only what will happen is the body temperature will be brought back to normal, right? Now how this the heat loss can be promoted, right? One very important thing is by increasing the secretion of sweat. So what happens is, in the sweat along with the water, even the electrolytes also are lost, and at the same time majorly the heat is lost from the skin. Second thing, by inhibiting the sympathetic center in the posterior hypothalamus, there is some cutaneous vasodilatation also. So when this cutaneous vasodilatation occurs, automatically what will happen? The blood supply in these cutaneous blood vessels increases, and as a result, as it is present nearer to the surface of the skin, automatically more sweat production is facilitated, right? As a result of this, hence the heat is lost from the body. Next, prevention of heat production. So as far as regulation of the body temperature, we are discussing about loss of how to bring back the increased temperature back to the normal. So one what we have discussed is how the heat is lost. Second is how to prevent the more production of heat. So here what happens is, there is inhibition of the various mechanisms which are involved in production of heat. That is nothing but metabolic activities, and second thing is shivering. So these two things are inhibited. So as a result, the production of heat is reduced. Now, what happens when the body temperature is reduced, right? So in such conditions, it will be brought back to the normal by two things. One is prevention of heat loss, and second is production of heat. Production of heat. Now how heat loss is prevented? So here what happens is, so whenever this body temperature is reduced, so automatically what happens is the heat gain center is stimulated, which is present in the posterior hypothalamus. So the sympathetic centers in this posterior hypothalamus, they are stimulated, and they cause cutaneous vasoconstriction. So as a result, the blood flow in the cutaneous blood vessels is reduced. So as a result, the sweat production is reduced. Hence, the heat loss from the body is, or from the skin, is prevented. Now coming to the promotion of heat production. So how that happens, right? So here first thing is shivering, right? So whenever we are exposed to a low temperature, automatically what will happen? We tend to shiver, right? This is because the heat gain center, that is going to stimulate the primary motor center for shivering, and this is situated in the posterior hypothalamus near the wall of the third ventricle, and once it is stimulated, the person will involuntary contraction of the muscles and twitching of the muscles will be there, and as a result automatically the heat production is occurring, and hence the it will help in bringing back the temperature to the normal levels, right? And at the same time, there is increased metabolic reactions, right? So the hormone production is stimulated, more amount of catecholamines are being released, and at the same time, even the thyroid production will be increased thyroid production will be facilitated by the hypothalamus by releasing thyroid releasing hormone TRH. So that TRH acts on the anterior pituitary, causes more release of TSH, and that TSH acts on the thyroid gland to produce more amount of thyroxine, and that thyroxine helps in increasing the basal metabolic rate, and automatically it helps in bringing back the temperature to the normal levels. So this is how the heat gain center functions, and the action of the heat gain center will occur. One is prevention of heat loss by shivering. Second is increasing the heat production by increasing the metabolic reactions by the help of hormones, that is the adrenaline and the thyroid hormones. So this one flow chart, if you see, it gives an explanation both what happens when there is increase in the body temperature and when there is decrease in the body temperature. On the left hand side of me, okay, the blue one, whatever you are seeing, okay, so that is about heat gain, right, when the body temperature is reduced. So what is happening? There is stimulation of the heat gain center. There is two things are happening. One is shivering. So shivering immediately increases the heat production, bring back the body temperature to the normal. Second thing is increase in the sympathetic activity. So as a result, two things are happening. One is cutaneous vasoconstriction, preventing the blood flow to the nearer to the skin, preventing the loss of heat, and helps in bringing back the temperature to normal. Second thing is it is increasing the adrenaline and thyroid hormone production, increase the metabolic rate and produce the heat and bring back the temperature to the normal level. So this is about the heat gain center. When on the yellow side, if you see the yellow side, it is on the right hand side of the slide, you can see it is about heat loss center stimulation when there is increase in the body temperature. So as a result, two things are happening here. One is preventing the heat production, that is by preventing the shivering, and second thing is increasing the heat loss. So that is again by increasing the dilatation of the blood vessels, cutaneous blood vessels, so more sweat is produced, and second thing is by decreasing the metabolic activities and decreasing the adrenaline action, so automatically the heat production is reduced and brought back to the normal level. So this is about the temperature regulation. Now coming to the applied aspects, two things are there. One is hyperthermia and second one is hypothermia, right? Now hyperthermia, it is nothing but the fever. So here the elevation of the body temperature above the set point 37 degrees centigrade, it is called as the hyperthermia or fever or pyrexia. See, two things are there in the exam to confuse you people. They will ask you the question hyperpyrexia, right? And even in the Viva also they will ask you hyperpyrexia. What you people tend to do is for hyperpyrexia also you write the answer for pyrexia. Read. You write the thing pyrexia, then you go to hyperpyrexia, no problem. But if you just write pyrexia for hyperpyrexia, you are going to lose the marks over here. So we will go to hyperpyrexia. First we will discuss about pyrexia. So here the fever, it can be classified into three groups: low grade fever, moderate grade fever and high grade fever. So low grade fever is when the body temperature it is between 38 to 39 degrees centigrade, that is low grade. Moderate grade is between 39 to 40 degrees centigrade, and high grade fever it is between 104 to 107 degree Fahrenheit, right? So this is a high grade fever. Now coming to hyperpyrexia. So hyperpyrexia is if the body temperature is beyond 42 degrees centigrade or 107 degree Fahrenheit. So in such conditions it is considered as hyperpyrexia, which very dangerous condition, because there is like the body tissues will be damaged, the person can end up in seizures, especially the elder aged people, right? So they end up in seizures, coma, and even the death also can occur if it is not immediately treated, right? So this is about hyperpyrexia. Now coming to one of the causes, so we will discuss few causes here. One is infection, definitely one is infection, right? So here the bacteria or the parasites, right? So they release from them the pyrogens are being released, and they affect the heat regulating system in the hypothalamus, and hence they result in the production of excess heat and development of the fever. Next is hyperthyroidism. So we already discussed about it. Thyroid hormone regulates it is a factor regulating the basal metabolic rate. So more the thyroid hormone, more will be the basal metabolic rate, and more will be the temperature of the body. So hyperthyroidism, definitely it is going to cause increased body temperature, and hence it is fever. Next is brain lesions, right? So whenever there is involvement of the temperature regulating centers in the brain, okay, if there is damage, injury, right, so automatically what will happen is there is occurrence of fever, right? If the thermoreceptors, they don't function normally in the anterior hypothalamus, okay, preoptic nucleus of the anterior hypothalamus, so automatically what will happen is there will be continuously increased body temperature. Then next is diabetes insipidus. So in this condition the fever occurs without any apparent cause. Coming to the signs and symptoms of the fever. So signs and symptoms, again it depends upon the cause of the fever. So various signs and symptoms: headache is there, sweating is there, shivering is there, myalgia, muscle pain, and then there is dehydration because of loss of heat from the body, because of production of excess sweat. So water and electrolytes are lost. The person ends up in dehydration. Then there is loss of appetite, generalized weakness. So these are all the symptoms of signs and symptoms of fever. And if the person is having hyperpyrexia, so the person goes for confusion, hallucinations, delirium, irritability, then convulsions, coma, death. So all these things can happen in hyperpyrexia, right? Coming to hypothermia, another applied aspect of body temperature regulation. So hypothermia, it is nothing but decrease in the body temperature below 35 degrees centigrade, right? And it is considered as the clinical state of subnormal body temperature when the body fails to produce enough heat to maintain the normal activities, right? So this is encountered during the severe hypothyroidism. Okay? So here what happens is, in this hypothermia, the major setback of this condition, it is the impairment of metabolic activity. Just now I told you, hypothyroidism also same things happen, right? And when the temperature of the body, it falls below 31 degrees centigrade, it is life threatening and fatal. The person can die also. And elder people are more susceptible for this hypothermia conditions. Coming to the classification, same like hyperthermia, here also you have three: mild, moderate and severe. So mild, when the temperature falls between 35 to 33, it is mild hypothermia. 33 to 31, it is moderate, and severe hypothermia is less than 31 degree centigrade, which is fatal if not treated immediately. Coming to the causes of hypothermia, so exposure to the cold temperatures, so definitely this is a very important cause. Then immersion in the cold water, in the cold ocean water, sea water, right? Then drug abuse, hypothyroidism, hypopituitarism, lesions in the hypothalamus, right? And hemorrhage in certain parts of the brain stem, especially the pons of the brain stem. So these are the causes for hypothermia. Signs and symptoms: in case of mild hypothermia, there is uncontrolled intense shivering, and this affected person, so he can manage himself, but what happens is, because of that shivering, the movement becomes less coordinated. So he may he is not able to coordinate the movements. Like he can't lift, if he goes to lift a glass, there is a chance that it may fall down. He can't hold the pens. So movements becomes less coordinated, and the chilliness, the cold temperature, it is going to cause pain and severe discomfort in the body. So these are the symptoms and signs in mild hypothermia. Next, moderate hypothermia. So here what happens is, once the person shifts from mild to moderate hypothermia, the shivering, which was intense during the mild hypothermia, it slows down, and it can stop also. Okay, but here what happens is, because of the continuous shivering, the muscles would have ended up in stiffness, right? Next, the mental confusion will develop, and apathy, he will have lack of feelings or emotions, because he is totally because of that hypothermia, his mind will be blocked, right? Then the respiration becomes shallow and is followed by drowsiness, right? Then the pulse becomes weak and blood pressure drops. Sometimes a strange behavior is also developing. So all of you can remember the climax scene of Titanic movie. So all these things can be seen over there, like mild hypothermia, moderate hypothermia. Next, severe hypothermia. The person feels very weak and exhausted. with incoordination and physical disability. Skin becomes chilly and it changes the color to the bluish gray. Okay, it was classically, all of you, I think you remember the Titanic movie, right? And the eyes also become dilated. The person gradually loses the consciousness. Breathing also slows down, and that is followed by the stiffness of the arms and legs, not able to move. Pulse becomes weak, blood pressure decreases, and finally the person becomes unconscious, not responding, and finally, if it is not treated also, death. So this is about the severe hypothermia. So that's all for today's class. So we have discussed about the functions of the skin, right? So this can be a 5-mark short note or a 3-mark question for you people. Then we have discussed about the body temperature. What is the normal body temperature? What are the different methods by which you can check the body temperature? You got the oral temperature, axillary temperature, rectal temperature, and the surface temperature, right? And what is core body temperature? We have discussed about that. And what are the mechanisms by which the heat can be generated in the body? What are the mechanisms by which the heat loss is occurring from the body? And what are the centers present in the brain which are helping in this regulation of the body temperature? That is hypothalamus, anterior hypothalamus and the posterior hypothalamus part. Thermoreceptors playing an important role here. Okay? And the heat mechanism by which the heat gain is occurring, mechanisms by which the heat loss is occurring. Then we have discussed about the applied aspects, right? So hyperthermia and hypothermia. We have discussed about the difference between pyrexia and hyperpyrexia. So pyrexia temperature, if it is more than the normal set temperature, right? Hyperpyrexia, it is the more than 107 degree Fahrenheit, right? So please don't get confused with pyrexia and hyperpyrexia. If hyperpyrexia is asked, it can come as a 3-mark question for you people. So first write pyrexia and then you write hyperpyrexia. But don't just write pyrexia and leave it off. It is going to like you're going to lose marks. If the hyperpyrexia question is asked, and you just write pyrexia over there. Okay, so then we have discussed about the hypothermia. So what are the 3 classifications of hypothermia? So I repeat once again, when we see the climax of the Titanic movie, you can easily see all these features: mild hypothermia, moderate hypothermia, severe hypothermia, and finally the death. Okay, everything is so nicely, like you can see over there. Okay, so that's all for today's class. It was a good time having spent with you. Thanks for bearing with me. Again, please stay home, stay healthy, eat healthy, protect yourself, and take care of yourself and people at your home. Okay? Take care.